British Columbia is facing the greatest opioid crisis in the nation, and fentanyl accounted for nearly 82% of illicit drug deaths in BC between 2016 and 2018. While Northern Health, which covers the top two-thirds of the province, has seen fewer deaths per capita, Prince George itself is on par with the Lower Mainland. But the root of this problem goes much deeper.
I think we have to understand and start shifting some of that dialogue around, it's not around sort of normalizing it, it's about building community education and awareness around the complexity of it. It's not just a health issue, it is for certainly a health issue. And so like in Northern Health, we're doing lots of things to address what we can, but it's bigger than that, right? It's poverty, it's about a lack of actual formal poverty reduction plan over the years. We haven't had that in BC. I think it's just now that they've recently released their provincial poverty reduction plan. So I think that's really important for us.
Nobody chooses to be an addict. This isn't a life choice for the individual. This isn't what their parents wanted for them. This is a human being who is struggling, and they've called you for help, and I need you to help them.
The city recently commissioned a report on the face of poverty with some surprising results. The majority of hospitalizations due to substance abuse can be attributed to alcohol abuse, which is 5 times higher than cocaine, opioids, and stimulants combined. The same holds true for the number of deaths related to substance abuse, and poverty is everywhere in this community.
Oftentimes when we talk about poverty, people's minds go to the homeless population. We know in our community that comprises, from our point in time count, about 160 to 200 people. But I think what was really clear for us from the Profile of Poverty in Prince George report is that poverty extends beyond just those individuals who are homeless, and there's pockets of poverty throughout different neighborhoods in our community.
The escalating number of opioid deaths led the province to declare a state of emergency, but after 3 years, is it still a crisis?
If we call it a crisis year over year, it's going to lose its impact. And the answer isn't always just throw more resources at it. We need to look upstream into what's causing it. Let's deal with the social issues. From an ambulance perspective, BC Emergency Health Services provides those resources and will respond to the calls associated from it, but we are by no means the answer.
So while dealing with poverty is part of the prevention pillar, the fourth pillar is treatment.
Sure, we need harm reduction, and that's really important because we've always felt that keeping people alive long enough to have a choice is very, very important, of course. And the whole healthcare system is based on saving lives. But I think the bottom line is then people need the opportunity to get off of whatever they're on if they're ready.
Isn't that ultimately the end goal, is to get people off the drugs?
No, I mean, that's really individualized. That's really up to the individual. So, it's not abstinence isn't the goal for everyone. Sometimes food is, sometimes housing, sometimes getting my children back. Sometimes all of those pieces are goals, and abstinence isn't necessarily a goal for everyone. Treatment is definitely a challenge. It's definitely a challenge in rural, remote communities where often people have to travel outside of their home community to receive, specialized services like detox and those kinds of things. And we've been working really hard. That's definitely something in Northern Health we've been trying to do, is increase our providers in community. Right now, treatment for opioid disorder is really held by physicians and nurse practitioners. No, I mean, that's really individualized.
That response came as a surprise to Mayor Lynn Hall. He says for him, as a non-professional in the field of mental health and addictions, treatment is the end goal.
If you were to ask me what I would think would be the goal, I would say, well, it would sure be nice if the person we see walk by us who is obviously either intoxicated or drug addicted, to get them healthy, to refrain, to get to abstinence so that you can kick that habit. The biggest conversation I have is around treatment facilities. Those conversations take place with other mayors from other communities. They take place across the country.
There's so many people in...
Murray Krause has worked with the Central Interior Native Health for years. He says the troubles around mental health and addictions really began to magnify when Riverview Hospital in Coquitlam closed in 2012.
When Riverview was closed, we were promised that there would be resources in our community. Those never happened. And so even when it was happening, there was some of us in the community who were working in the community saying, we're not ready, stop the process. And so, but it happened anyway. And it doesn't matter which community you go into in British Columbia, especially at the larger centers, there's people on the street that you can see that think they need a bed somewhere. And they're identified by service providers and others that they need permanent care until, they might need permanent care forever, or they need permanent care until they get the help they need to get back out being a part of society.
Northern Health has a long list of treatments available. There is day treatment and community outreach. There's also opioid agonist therapy. That's akin to a methadone treatment for heroin addiction. That is administered at the Nechako Treatment Facility on Allward Street, and it is physician-led. There are 4 spaces for residential treatment or rehab set aside for Northern Health at facilities outside the region. Not good enough, says Krause.
We need to invest more resources. And I know it looks like, cash strapped, we don't have any more money, but we can keep doing what we're doing and have the same thing happen over and over. So we really do need to invest to have an impact.
Whether the opioid issue and its impacts on the downtown and the city as a whole rests with local government or with higher levels of government matters little. The scope of the victims of the deadly drug, the addicted, the mentally ill, the business community is growing, and there seems to be no end in sight. Cheryl Jan, CKPG News.